Do you not feel like yourself? Are you tired all the time? Do you feel sad, hopeless, lose interest in things you love? Do you feel anxious and can't sleep? Do your daily activities and relationships suffer? You know when you don't feel right, but something you might not know is these are all symptoms of depression. While the cause of depression is unknown, it may be related to an imbalance of chemicals between nerve cells in the brain. ESCITALOPRAM, also known as Lexapro, treats depression by increasing levels of serotonin in the brain. If you know what is wrong, you can help make it right. Call your doctor to get your depression diagnosed today.
Hello.
Hi Cameron, I'm Cora. I'm going to be your nurse today. Can you tell me why you're here?
Just thoughts of depression and suicide.
Okay, so I'm going to go ahead and get some vitals and then we'll do a depression screen.
Okay. Are they all okay?
They're all right. Okay, I'll be back. Hi Cameron, I have your depression screen here.
Okay.
So I just want you to answer some of these questions for me. On a scale of 0 to 3, 0 being the best and 3 being the worst, over the past 2 weeks, how often have you been bothered by any of the following problems? Little interest or pleasure in doing things.
3.
Feeling down, depressed, or hopeless.
3.
Having trouble falling or staying asleep or sleeping too much.
3.
Feeling tired or having little energy.
3.
Poor appetite and overeating.
3.
Feeling bad about yourself.
3.
Feeling like a failure or letting family down.
3.
Do you have trouble concentrating on things such as reading or watching TV?
3.
Moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety and restless.
3.
And finally, do you have thoughts that you would be better off dead or hurting yourself in the same way?
3.
Okay. All right, Cameron, thank you. I'm going to give this to your doctor, and he'll be in to see you soon.
Okay.
Hi, Cameron. I'm Dr. Jones. So it looks like you do have depression. So I'm just going to start you off on some ESCITALOPRAM, which is better known as Lexapro. So I'm going to start you off with 20 milligrams a day. And you can take it either in the morning or at night, but most people prefer to take it at night because it does make you sleepy.
Okay.
I just want you to come back in a month for a follow-up appointment. This med does take 2 to 4 weeks for the effects to kick in, but if you do feel yourself getting worse, I do want you to come back in.
Okay.
All right. Thank you.
Thank you.
ESCITALOPRAM, brand name Lexapro, is a selective serotonin reuptake inhibitor and an antidepressant. It is used to treat depression and generalized anxiety disorder. You should call your doctor if you are taking this medication if you are pregnant or breastfeeding, have renal or hepatic disease, have a history of seizures, or if you are taking any anticoagulants. For depression, this medication should be taken by mouth up to 20 milligrams a day. Take it with a full glass of water once a day. This medication may take 1 to 4 weeks to see therapeutic effects, and you may have increased anxiety for the first 5 to 7 days, but do not discontinue abruptly. Report immediately if you have nausea, vomiting, sedation, dizziness, sweating, facial flushing, mental changes, or shivering. Use caution when driving, performing other activities that require alertness, because drowsiness, dizziness, and blurred vision may occur. Avoid alcohol and other CNS depressants. Avoid all over-the-counter meds, herbals, and supplement products unless approved by your provider, and change position slowly. Clinical worsening of depression and suicide risk may occur, especially in adolescents or young adults. Notify your provider if you are pregnant or plan to become pregnant, or if you are breastfeeding. Common side effects include insomnia, drowsiness, anxiety, tremor, dizziness, fatigue, sedation, abnormal dreams, postural hypotension, nausea, diarrhea, dry mouth, anorexia, constipation, taste changes, decreased libido, impotence, ejaculation disorder, sweating, rash, pruritus. Some serious adverse reactions that may occur include suicidal ideation, neuroleptic malignant-like syndrome, hepatitis, serotonin syndrome, and Stevens-Johnson syndrome. The cost for escitalopram oral tablet 10 milligrams is around $19 for a supply of 30 tablets, depending on the pharmacy you visit. Quota prices are for cash paying customers and are not valid with insurance plans.